Irene in the chair, and Irene is here today for a Skin Classic treatment, which consists of a microdermabrasion and the Skin Classic treatment. I'm going to cleanse her. She has a little makeup on, so I'm going to cleanse her with some green tea cleanser, nice warm water. And as before, I told you I used my products from Vivant. I like their products. They're doctor formulated. They really change the skin for me and my clients, so I like them. But this is a gentle cleanser. Go ahead and close your eyes, Irene. That's great. Irene, have you ever had microdermabrasions or any kind of skin treatments?
No, I haven't.
Okay. And Irene, again, is another one of those gals who's taken care of everybody for all these years and has decided that it's about time for her. And so little by little, she's done a few things. Her eyebrows, her eyeliner, and now she's going after her skin. And Irene has basically very nice looking skin, but everybody over the age of 35 or 40 starts to have some minor skin irregularities that should be addressed. And we can address those with microdermabrasion and the Skin Classic treatment. So she's been cleansed, and now, Irene, I'm going to use another product on you. It's an alpha hydroxy witch hazel toner. And what it's going to do is take down some of the cells chemically, and it's going to degrease the skin so that the microdermabrasion procedure goes much smoother. Again, when you're doing these procedures over somebody's had permanent eyebrows, avoid the tattooed area because it can lighten it premature. I'm going to turn you this way. Great. And at this time you can, again, start to get a head start on your minor skin irregularities that you're going to show your client that you're going to treat. I'm going to turn you this way. Anything bothering you about your skin, Irene?
The dark circles under my eyes.
Oh, she had to say that. Mm-hmm. You know, I would love to have an answer for dark circles under the eyes, but I don't. I don't know anybody who has a great remedy for that. And what dark circles really are conglomerations of little blood vessels, but as they peek through the skin, they look brown. So there's a lot of red in brown. Okay. Maybe she needs a Hawaiian vacation. I don't know. Okay.
Or sleep.
Or sleep. There we are. So now I'm letting the skin dry. And I'm going to get my microdermabrasion ready. And at this point, what I like to do with my clients, even though we've already consulted, I'm going to ask Irene to go ahead and take the handheld mirror and just hold this mirror for me, Irene. And what I'm going to do is show you everything that I'm going to be able to do, okay? First, I'm going to turn you here, this side. And you have a few little brown spots. See these little brownies? Mm-hmm. Okay, we're going to take those. This, you've got some clogged pores that you can see right there. Mm-hmm. Okay? And that's been there for a while, and the skin just has grown over and has gotten thicker, and we're not exfoliating enough, so things get trapped in the skin. You have a few of those. You've got a little bit, you've got some brown spots here as well as there. If I come down the cheek area, you've got a little cherry angioma, a couple little brown spots, but not so bad. Little bit in here. Here's where you have more brown, and I will address this for you. Now, I'm not going to address this entire spot, but see, there are the darker little spots, and that may make your eye appear a little less brown to you because you do have brown spots there. Okay. But this brown in here will not be addressed by the Skin Classic. It won't work on that. You've got a few little brown spots in the nose area. If I turn you this way into the light, couple brown spots, a couple raised brown spots, which we'll call fibromas or raised hyperpigmentation. Again, a clogged pore, a little blackhead. We'll take out all these little tiny brown spots there. Okay, if we go to the neck, Irene has a few little skin tags that are very tiny. They're not the ones that have a stalk. She's got some tags here as well. I can feel them. And you have to start to get used to touching and feeling these things because you will feel them raised, as well as her cherry angioma there. And a couple more raised hyperpigmented areas here and there. So does that sound good to you, Irene?
Yes,
if we
it
do
does.
all that?
Yes.
That's perfect. And I've already asked Irene if she has any skin tags. Many of my clients, when they come to see me and I address those issues that they're talking about, then they find out that I do skin tags too, and they'll say, oh, I wished I had known. So I ask my ladies all the time if they have any skin tags under the arm, under the bra area. So, okay, now Irene, you can go ahead and close your eyes. Microdermabrasion will not hurt at all. It actually feels like a cat licking your face. And I'm going to give you a few sweeps of it, see how it feels for you, and then go from there. If anything's uncomfortable at all, you'll let me know, right?
Okay.
Terrific. Okay, okay. So I adjust my microdermabrasion right at about 15. Go ahead and let your chin down just a little bit. Great. Again, I start at the forehead, always at the crown, because I think there's less nerve endings and it's less surprising. If I start here, it's easy. If I start right there, I really may startle my client. So I'm going to give you a few sweeps of this. Does that seem to be okay for you, Irene?
That's fine.
Okay. Everybody's got a little bit of a different bone structure. She goes here and then it comes down. So if you feel like you're not getting good contact with the skin, do the brush stroke. Start near the eyebrow, come to the crown and kick out. I like to try to stay on the skin at all times, but if the bone structure is such that it's not allowing me to, the brush stroke is what you want to do, or that twisting motion. Very methodical. It should be relaxing for the client, but it should be relaxing for you as well. Many people, like myself, do permanent makeup a lot, and then when you do skincare procedures, it's very relaxing for me. So you can see that she's turning pink. That's the end point of microdermabrasion, is pinkness. It can be a little pinker if you like, but I generally like to just be pink. My clients sometimes come to me and they'll say, oh God, I thought I was going to be beet red and I would have to hide out. Not true. Not for microdermabrasion. Perhaps other procedures and other facilities that are more aggressive. So again, I'm getting much closer to the minor skin irregularities. The stratum corneum is being relieved. Everybody's skin is different too. You may wind up being very easily to stretch somebody's skin and somebody else not. So here, I may brush it up. There's no right or wrong way so long as you cover the area of the face. 3 different approaches. So to relieve the stratum corneum, if you like to go back and forth first, up and down first, it doesn't matter. You'll get your own little niche down. And these diamond encrusted headpieces that I use for my microdermabrasion should never wear out unless you microdermabrade metal. If you're just using skin and you remove these tips, clean them with a bristle brush, and sterilize them or disinfect them, then you should be fine. You should not have to replace them. And they do come in different grit strengths, from rough and irregular to very fine. So you can choose whatever you want for your client. Great, I'm going to turn you this way, Irene. So far, everything good?
Mm-hmm.
Okay, great. Remember the stretch, you anchor and then let your thumb kind of pull along. This way you'll get a really good stretch here. It's hard to almost get 3 different ways around the eye, but if you can, great. If not, what you can do is this as well, is twist. Very effective. Again, we don't want to go over the permanent eyebrow, but right under there, that would be a nice place to, that's what I would like to have done, so I know my client would. Great, so that area is done. Now we're into the cheek area, which is a big square, as shown on your schematic coming with your microdermabrasion machine. And we go vertical. I like to pull down on the skin rather than trying to stretch like that. I'm going to turn you just a bit more. Great. And again, if anything's uncomfortable for you, Irene, let me know.
Okay.
Now, like we said before, microdermabrasion can be done once a week for clients that have already had their minor skin irregularities addressed. And then once a month after that. If you have an acne client, my rule of thumb for my clients is every 2 weeks with the acne, and at that time I'll treat them with the Skin Classic as well as often as needed. But the Skin Classic treatment should not be done on the same irregularity within the same month. I'm going to do a diagonal. And then just remember, there's no need to rush through your microdermabrasion. You never want to gyp your client. You really want to give them all the benefit of the microdermabrasion. You want that diamond encrusted head to break up those cells on the skin gently. Have the vacuum sweep away the dead cells, invigorate the dermal layer where the collagen and the elastin is restranded. And it's relaxing for them. This is the time where, if you've educated them already, you can just be quiet while you do your microdermabrasion, or your client may be asking you questions about your practice. What else do you do? And that's when you can tell them. Or you can start to talk about her skincare that you'll want her to use at home. Whatever product that you're using in the office, this is the perfect time to start addressing her skin issues, whether they be brown in the skin, fine lines, fine wrinkles. Clients have a lot of questions about skin and what we can do for them, and even if it's something that I can't do for my client, I always have a resource for them. If they're interested in Botox or Restylane, or they're concerned about their fine lines and wrinkles, I'll send them to somebody. I like them to be well educated and have options and resources available to them. Did the up and down, up and down. Now I'm going to go back and forth. And if you do it exactly the same way all the time, sure, it can get monotonous. But while you're chatting with your client about other procedures or skincare, you won't forget what you're doing. You'll do it the exact same way all the time. Do the diagonal. Sometimes I like to twist the headpiece so it moves a little bit freer at the ends of my stroke. And I'm keeping my rows as close together as possible. Just if you can imagine mowing the lawn. You don't want to skip a little bit of a row. You want to almost have them on top of each other. And then I do the chin, upper lip, nose, and that little area there. I I tend to come down around the bottom. Again, I've always been staying right behind my client. I don't tend to move from side to side. It's a lot more energy. And sometimes you may be in an office where your table's up against the wall. And if your table's up against the wall, you'll have to work right at the head of the table. If you're in the business for a while, your posture and all is very important. So make sure that you have a comfortable chair and you're straight on your client. Remember, the client's head can swivel. Here I'm just stretching this way. You'll find different ways to stretch according to the client's skin, the facial structure, so not everybody is the same. This is a little bit of a tighter area. Sometimes it's hard to keep the suction onto the skin at all times. So now if Irene was just having microdermabrasion, what she would expect today would just be some pinkness, that she would almost feel like she had a little bit of a windburn. But if she wanted to go out tonight and go to a party or go to a function, she'd be more than happy to do it after a microdermabrasion. She'll have a glow to her. She won't be beet red unless we take care of any irregularities. And then she'll have some little brown crusties or a little lifted area where the clogged pores were, that type of thing. But for just a microdermabrasion, they're fabulous to do any time of the year, even if it's in the summertime. Just consult with your client and make sure that they're going to use their sunblock regularly. I have golfers that will have a microdermabrasion and then go out golfing that day. Of course, they're under a hat and wearing sunblock, but it can be done. Soccer moms, they're not going to hide out, so you just want to counsel them and make sure that they are using their sunblock. No graceful way to do a nose. I like to just stretch it over. I like to do the twisting motion in here because it really cleans out this area real well. The bridge of the nose, you won't get much great suction on, so there's not much to do there. When working with cords around the client's face, it's always a good rule of thumb to not let the cords drag along their cheek. Always have it up over your arm so that they don't feel that. Turn down this suction and start with the neck now. Go ahead and lift your chin for me, Irene. Great. And you can just keep your eyes closed. I like my clients to always have their eyes closed, and for more than one reason. I like them to relax. And in the beginning, I never really wanted them watching me. So let them close their eyes, and this way nothing will splash them in the eye. Nothing will, if one of your cords is coming across the face, you won't have a scratched cornea. So definitely try to have them close your eyes and relax. Turn you just a little bit. Great. Pull that skin down. Great. And get all the way back by the ear there. That's where the lymphatics are flushed. So after a microdermabrasion, it's great to tell your client to make sure they drink plenty of water as their lymphatics are starting to drain. You're invigorating that area. Turn you straight on. How's that feeling for you, Irene?
That's great.
Oh, good. And so many benefits to just microdermabrasion, the resurfacing of the skin, and on a very routine basis, the more that we take the top layer of skin off, that we remove it daily, the more the skin will remake itself. It makes it thicker. When the stratum corneum comes off, the skin underneath says, uh-oh, we gotta make more skin. And as it does, it makes it thicker. So on a routine basis, that's how the fine lines and fine wrinkles are addressed. Now, if I'm doing her décolleté, which I will do, again, I stretch out here. I'm on a little bit of a lighter setting. People love to have their décolleté done. Just make sure that whatever your price package is, you do charge accordingly. Anywhere on the body can be microdermabrated. The hands, people love to do the hands. I have clients or students say, well, gee, that's great. We can probably microdermabrate the feet. And I tell people if they really need to have their feet microdermed, they probably need a really good pedicure. So I would refrain from that. But the back is a perfect place to microdermabrate. And these headpieces with this machine, you'll have very large ones too to cover large areas. So that's a nice option, especially if you're in a spa that does a lot of back facials. And of course, the Skin Classic is a perfect place for the back. Go ahead and flip my timer up a little bit more. With the décolleté, it will run over, so. Great. Okie dokie. So now we're going to proceed to do the Skin Classic, and we've identified things with prior clients. So what I want to do is kind of get through and fire through the face so that you know that the procedure really does not take very long. We did a little bit more instructional before. We won't need to do as much this time. So I've already consulted with my chair-side guide for all of the minor skin irregularities that we will be doing. And keep that right by your chair so that you can adjust the intensities. You may use the same probe a lot, but the intensity may change. So just be cognizant of that so that your client will... for a second. Okay. So I'm going to use my 012 probe. My favorite probe, but it is so versatile that it can be used on nearly every one of the minor skin irregularities. You may need one or the others as a specialty probe. For example, the skin tag probe. So, okay, so we've already pointed out Irene's minor skin irregularities. Irene, can you just let your chin come down now? That's good. Okay, great. Now, just like the microdermabrasion, I like to work from the forehead, go over, just the same schematic as I did for the microdermabrasion. Okay, Irene, you've not had this done before, so I'm going to give you just a small little touch to make sure everything is fine for you. And she does have a couple little brown spots, So right, I'm just going to give you a little touch, Irene, so you get to see what this feels like, okay?
Okay.
Scale of 1 to 10, how was that for you?
A 5.
A 5, okay. Okay. Okay, so what I'm going to do is I'm going to start here and look for any little, she's even got tiny little brown spots here. The smaller they are and you get them, the better. Done. I'm going to see if she has any other brown in her forehead here. Not a lot, and again, it's because a lot of the forehead is covered by bangs and hats as we're younger. She does have clogged pores. I just set my intensity for the clogged pores. Now again, the clogged pores, when you touch, you're just going to touch over the pore till something happens. And the pore opened, and there we have some of the material that came right out. This one's a little bit bigger. Okay, so my foot is now off the pedal, and I'm going back into the pore. Okay, now I'm going to go in and out of this pore to help dry that up. Again, I'm not a big picker when it comes to using the Skin Classic. That will dry up now, so I'm not worried about that coming back. Same with this little one here. Off. Just going to stretch it just so that the pore is large enough for the material to come out of when it dries out. And came out right there. Now she's got, I can see these clogged pores. I don't know if you can on camera, but all you want to do is touch them and it's unclogging them. You okay, Irene?
Yes.
Okay. Still a 5 or has it changed?
It's the same.
Okay. Okie dokie. So here she's got kind of a larger brown spot. And so all I want to do is tap, 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 tap. Back. Give her a little rest. Good. And that's treated. We're just going to leave it alone. Okay, so now we're on this side of the face. So I'm going to go right by the ear here and see if there's anything. I do see a little cherry angioma. I'm going to touch the cherry angioma till it changes in color and it's gone. They usually behave like that. Larger ones will need a little bit more touching until it changes, but that's gone there too. Very rarely do you need to retreat cherry angiomas unless they're very large. Okay, so she's got some diffuse brown in her skin, but the darker areas are what I'll be going after. That was a little raised hyperpigmentation or a fibroma. You saw how it turned white. It just sort of disintegrates those dead cells. She does have some blackheads here, if you can see those. Perpendicularly, I like to touch. Come right out. Okay, if you can see on camera how that just came right, just followed the probe right out. So there's no mashing and stretching of the skin. It's done. So it's a nice way to do extractions because you're not going into the skin, you're going into the pore. Good. I don't have any current on, I was just picking that out. Good. Okay, so now she's got these brown areas right under her eye there. And I will warn her that it could be a little sensitive. But I'm going to stretch the skin very well. If you stretch the skin, it's less likely to be uncomfortable for the client. So when I stretch, I'm going to put a little witch hazel on it because that's what the laminated card says to do. And here, these little brown spots, it's tap, 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 tap. Was that okay for you, Irene?
Yes.
Okay, good. Now she's not really, I don't see her moving around too much, so it's fairly comfortable, but don't let that fool you. Sometimes your clients are sitting there and something will bother them, but give them a little rest every now and then. Tap, tap, tap. Just want to moisten a tiny bit with that witch hazel. You don't want it to be sloppy wet. You okay? Mm-hmm. Okay, good. Okay. So she's got a couple, I'm going to move over to this side of the face, but before I do, she's got a couple little brownies right on the nose. And believe me, these things don't get any smaller. So you may as well address them. Now, do you wear glasses all the time?
Yes.
Okay.
Well, not all the time.
Okay, I can see that she does. And she's got a tiny little brown spot there. And of course I'd like to take it off, but it's right in the pad of her glasses. So it's not, I don't think it's that important to do it. I like to get after every single thing that I can. But there I think it might irritate her. So I'm going to turn you all the way this way, Irene. Now I'm going to do this side of the face. Just pretty clear in here. I can see a little brown spot there. Okay, and so just to show you that that's all it takes to remove these, retreat them. And there it is. So now you just have a little bit of a area that's still a little light brown, but the brown is on the Q-tip there. Okay, she's got a little mole right there. Here was a little blackhead. So again, let's go in perpendicular. Okay, now I know current. Okay, now I have my tool just in case I can lightly get this out, but it's already lifted. Don't really want to push hard and over traumatize. There we go. Good. So I'll just take that away. There's no current. There we go. I'm just going to wipe it gentle with the cotton. I don't want to over rub it. It'll over irritate it. A couple little, get a clean Q-tip. Little brown spots, so it's tap, 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 tap. Tap, 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 tap. So when you have a lot of brown in the skin, this is what you do. A lot of brown spots. People say, oh gosh, how can you treat so many? You can if you work yourself in a grid so that you don't skip around. I've already done that side of the face, so I won't even look at it. I won't worry, did I do that part? I'm working in strips here. A little bit of brown under the eye here like she did on the other side, so I'm going to dress that. That's a little too sloppy, wet. Tap, 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 tap. Sometimes you have to let the skin up in order to see exactly where it's brown. Okay, now she does have a little raised hyperpigmentation there. Tap, 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 tap. So it's not, and just so you know, it's not poke, 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 it's tap, tap. You're barely touching the skin. Okay, so now I'm going to start on the neck. She's pretty well cleared out there, unless I think I missed anything. Okay, so I'm going to adjust my intensity for these little flat skin tags. And again, they're treated like a flat hyperpigmentation. Tap, tap, tap until they change in color. They'll be white because all the dead cells are just disintegrating. You okay? Okay, good. I'm going to finish up this part of the neck now, trying to be as methodical as possible. Tap, tap. It's this fast and this easy. Of course, though, give your client a little rest. Okay, so let's just revisit the fibroma. And I'll give that a little wipe. And it's gone. So just know that what you do does go away. Don't over-treat it. Here's a cherry angioma. We're going to touch until it changes in color. And then we're going to come back down on another area till it changes in color. And again. And it did turn a little dark, but that's okay. It's not charring the skin. It's not like a bovie in surgery. There's no, you didn't smell any flesh burning, did you, Irene?
No.
Mm-mm. Because it's vaporizing the cells. And all of these cells are dead cells. Just get a little more witch hazel. A little too sloppy. There we go. Okay, now I'm going to do this side. I'll start at the very end. Everything going good for you there, Irene?
Yes, fine.
Good. Now on this side, you have the skin tags are just a little bit bigger, but still not big enough to get the tweezer out and pull them apart like we did on our last client. We're just tapping until they change in color. And then in about 3 or 4 days, as you take your shower, Irene, these will fall off. But don't get over aggressive with them when you get out of the shower. Just pat yourself dry. Don't take your terry cloth and rub real hard, okay? Because they'll come off a little too soon. These don't bleed, but we don't want her irritated either. So Irene's got a really pretty décolleté color-wise. She's not real modeled, but she had these raised hyperpigmented areas that once these are gone, this will become a much more smooth looking décolleté. She'll be very happy. Because her face looks good too, but then when you come down there, there's some spotting going on. Okay, I'm just looking to see if you have any capillaries that need addressing, just a little bit. So I am going to change my probe, but I will tell you that this probe can also do these capillaries. It's a little bit larger, but for today's purposes, I want to use the exact same one that you should use on all of your capillaries. If you have a man or a woman that has larger ones, your 012 will be the probe of choice. So they are a little versatile. They all deliver the same energy. It's just the end, the tip is what you're interested in to match up with your minor skin irregularity. Okay, Irene. Irene does have a couple little broken capillaries here that I'm just going to address as well. Tiny, tiny ones. You okay, Irene, with that?
Yes, I'm fine.
Okay, good. So you want to hold to the skin. 1, 2, 3. 1, 2, 3. So let's just track these two little capillaries here. And I'm going to start here and go there. So 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. When you see the skin sometimes do that, there could be a little bit more oil in the skin. And if you hear it sizzle, there might just be a little more oil. So if the client's okay and comfortable, go about with your business. Otherwise, you may need to degrease just a little bit more, because that's just the sebum heating up. And that's what we heard, that little bit of a sizzle. So now she's got just a little bit more here. You can see that it immediately takes care of it. Now, if Irene isn't real gentle with her nose, she can disturb these. So we want to make sure that she treats herself very nicely. She's got one right there. And if you have your client in the chair and you come upon new minor skin irregularities, take care of them. It doesn't take but a few seconds. And for an overall more homogeneous look, that's what we're going after. So I think we're done unless I missed anything, which I don't think I did. Okay, Irene, I'm calling that done. Okay. So now what I'm going to do, I'm going to apply some aloe onto the skin, cool the skin down with our Microdermabrasion cold hammer, and then I'll apply a nice coating of moisturizing sunblock.
Okay.
And you're using sunblock religiously?
Yes.
Oh, good girl. That's good. Gotta do that here in Colorado, right?
Yes.
Yeah. I'll put some there. Now this will be nice and cool. Now I know a lot of you are estheticians out there and use a lot of, great products to cleanse and all. Use whatever you use. I'm more of the medical model, and I basically just get in there and cleanse the skin, or basically get in there and put some product on the skin. Do whatever you like to do in your practice, though. Okay, so this will get nice and cold. How's that feel, Irene?
Feels good.
Good. Now, if you don't have an apparatus like this, after you get done a treatment like this, however you could cool down the skin. Some people use the cooled gel packs. That's always a nice touch. I know people that use this pretty much just medically and just put their moisturizing sunblock on and they're out of the office. Whatever you like to do, you can always fluff up the treatment a little bit for your client. Pay particular attention to the areas that you did work so that you can cool those down, especially if you do a lot of capillaries. So again, I'm going to tell Irene, what you're going to do is come back in 28 days for another microdermabrasion. This way we can keep track and get you, see how your skin is reacted with the Skin Classic. I know how it's going to react. It's going to look really very, very nice. You're going to be more homogeneous. And then from there, that's when you start either your regimen of resurfacing. Some clients then, after their minor skin irregularities are taken care of, they want to address the texture in their skin. Well, that's the perfect time to do that. They're much clearer looking and they're going to get better results. So if you like to do peels for retexturizing, laser, microdermabrasion, your client will adhere to a great regime because you've already proven yourself. You've already gotten rid of their minor skin irregularities and really did change the look of their skin. So believe me, they're yours. Whatever you suggest they do, they will. So always invite them back 28 days for another treatment of your choice, microdermabrasion, a peel, whatever you prefer. Keep tabs on them, see how they're doing, and after a few months, they'll have more minor skin irregularities come up, and then you'll want to adjust them as well. There we go. A little red, little pink, but really, really not too bad. I'm going to give you a mirror very quickly here, Irene. Let you take a peek. Probably not as bad as what you thought, right? But these little areas here, the brown areas, see how they look like they're lifted? That's because the epidermis is lifting. The brown has come up off the skin. So they're going to crust up, fall off, maybe be a little pink under there, and be totally gone. Same way with these clogged pores here. You have some of those. So you'll notice that you may get more of them, but now you know how to take care of them. Your skin will feel smoother when you put your moisturizers on. Your skin, because of the microderm, but because of the clogged pores being gone, everything will feel smoother. This décolleté area as well, when you put your moisturizing sunblock on in a week or two, you're going to notice that you're going to feel so much smoother because those dead cells, those keratinized cells are gone.
Okay.
Okay? Good deal. Okay, great. That ends that treatment.